Questions. I know you've all got them. Hey, I'm Dr. Drew, and this is Strictly Sex. You know, you look in the mirror and you think, should my breasts look like that? Should my genitalia be, well, what's right? What's wrong? What's normal? Tonight, some answers. All right, let me have it.
Sometimes when I have an orgasm, I have a migraine. Is this normal?
Ooh. What's on your mind?
Hi, I was just wondering, I can have an orgasm while having intercourse. Is that normal?
Is he normal?
Is that a normal thing?
Is this normal? Is that normal?
Welcome to Strictly Sex. I'm Dr. Drew, and as a physician, radio host for more than 20 years, I've been helping people find answers to questions about sexual health, addictions, and relationships. Now, I often hear questions that end in, am I normal? Tonight, we'll define the criteria for what's considered normal and healthy, so you can have more informed decisions about your sexual health. We're talking about questions like, what is a normal physical reaction to orgasm? How long should sex last? How do you know when body image insecurities have gone too far? First, can you break your penis? I'm not kidding. I don't mean will you. Can you? The answer is yes, it is possible to break your penis. Here now is the story of a man who found himself in this truly painful and unusual situation. When Jimmy and Kelly were engaged, they experienced one of the most frightening sexual accidents anyone could imagine. He broke his penis during sexual intercourse.
I heard a crack.
You heard a crack?
Yeah, like
we both
when
heard
you crack your knuckles really loud.
And what did you think when you heard the crack?
I didn't know what to think.
Did this hurt?
No.
No pain at first?
No.
Jim and Kelly soon learned this wasn't an injury that would heal itself. It grew more serious by the moment.
First thing they said, we need to go to the hospital. There's something we need to do, and he's like, no, I don't want to go. He wanted to wait, and I went back to bed since he wanted to wait, and then he's like, it's changing colors and it's swelling now. So I'm like, I'm telling you, we need to go to the hospital. But still, he waited 2 hours.
By the time Kelly convinced Jimmy to rush to the ER, his penis was swollen and black. Fortunately for them, they were under the care of Dr. Simon Chin, a urologist with an expertise in broken penises.
They usually think that this is absolutely the first time it has ever happened to anybody. It's actually a whole lot more common than most people would think. The penis is basically comprised of two erectile bodies that are large blood vessels. In this type of injury with penile fracture, the penis gets misdirected or it hits something under a tremendous amount of force that causes one of these two bodies to break. And when it breaks, some blood will leak out. So the immediate effect with these injuries is that you hear a snap. And a lot of confusion about that leads to the belief that there's actually a bone in the penis, when in fact that's not true.
In most broken penis cases, the woman is on top. But Jimmy and Kelly's story is a little more dramatic.
He must have hit with a significant amount of force, because not only one of the barrels was injured, the tear went all the way across to the other side.
Despite the extent of Jimmy's injuries, Dr. Chin was confident he could repair the injured penis and give Jimmy and Kelly back their sex life.
The goal with surgery is to close up the tear that's formed in the erectile body. And we do that by basically bringing the skin back away from the shaft of the penis, localizing where the tear is in the corporal body or the erectile body, and then putting in some stitches to close it up to make sure that it's watertight again. Most of the men usually spend a night in the hospital. We'll then send them home with adequate pain medication. But the most important factor is to ask the gentleman to refrain from any sexual activity for at least 4 weeks until most of the surgical sites are healed properly.
How was it when you woke up, Jimmy?
It was painful. I didn't feel a lot of pain, you know, pre-surgery, but post-surgery, oh my God.
For how long?
Probably about 2 weeks.
2 weeks of the same intensity of pain?
Yeah.
With the pain and recovery behind him, Jimmy could return to his normal life. Oh, an incredible story, and for most people, a wow story. Not many people even know that a penis can suffer that kind of trauma, and it can happen quite easily. For more on this, I'm going to bring in the Chief of Urology of the VA hospital system in Los Angeles, Dr. Carol Bennett. Dr. Bennett, thank you for joining me. I really appreciate it. This is a sort of scary and uncomfortable topic, and a lot of people don't know how common it is. Is it that common?
It's really fairly common. I see, up to 4 a year in my practice. I think nationally you'd see about 10,000 a year.
10,000 broken penises, and no one talks about it. It's amazing. You think
Most people don't.
Are there people that don't come in for treatment and have a broken penis or are too ashamed?
Absolutely. In fact, the reason that most people present to the emergency room, most men present to the emergency room, is because, A, their significant other urges them to.
Which we heard in this story. Men will not go to the doctor for anything, unless they're convinced their penis is broken.
Absolutely.
And even that takes time.
Or B, because of a lot of pain. And pain and swelling are really what drives them to the emergency room.
Now, do all of these kinds of injuries need an operation?
Typically they do, but if they're not operated on, men can have resultant deformity of the penis, which is long-lasting, and can result in a lot of scar and dysfunction.
And I think you had mentioned when I was talking to you off the air that they can have minor injuries that may not cause pain. How do you know if you've got a broken penis, if it's minor?
You know that you have a broken penis because of swelling in that area, black and blue in that area, and the penis often is deformed in the area of injury.
He had no pain, interestingly, and he went across both barrels of the blood-filled bodies and the urethra.
Yes.
That's amazing.
Your patient was absolutely remarkable and a very unusual, exciting case, because I've never, as an example, seen full across injury. It's normally just one of the blood-bearing organs. He had both blood-bearing organs and his urethra.
That's amazing.
Which is very atypical.
See how we talk as doctors? You're exciting to us if you rupture both parts of your penis. It's very exciting.
Very exciting.
Thanks, Dr. Bennett. I appreciate you coming in and sharing this information with us. A very important topic and one that's really not talked about anywhere. Up next, what to do when sex ends too quickly. One man's story provides answers for many. Strictly Sex, we'll be right back. Ready? This thing's on? Hey, this is Dr. Drew, and the following program contains candid material which is of a sexual nature. Watch out. Viewer discretion is advised. I mean it. It's not intended that the content of this show be relied upon for medical advice. No kidding. Look, if you believe you require medical or psychological services, come on, consult your doctor. Welcome back to Strictly Sex. Tonight we're talking about what's normal when it comes to sexual health. One problem that is not uncommon is premature ejaculation. Up to 34% of men of all ages battle with anxiety associated with premature ejaculation. For many, this lack of control over sex leads to feelings of inadequacy. Darren Mitchell is one man who's finding he's not alone in his search for a solution. For 10 years, Darren Mitchell lived life on the fast track as a professional BMX bike racer.
Thanks. You're going to email it to me, correct?
Now the 33-year-old has switched gears professionally, and he's pursuing a career in real estate.
Yeah, I'm checking out.
But there is one challenge that Darren has been unable to overcome. He is one of the 30% of men who suffer from premature ejaculation.
First time it happened was basically the first time I had sex when I was about 16 years old. And it really wasn't a big deal to me because I didn't really know any different. I didn't know how long it's supposed to last or anything, so it wasn't that much of a shock. But as you get older, women start to make comments about it, and then you have to, you know, start thinking about it yourself.
Darren had to face harsh criticism from some of the women he dated.
It's a big deal to them. Some girls are like, I want to have sex for a long time, and you know, I'll straight up tell them that, well, I'm not the one for that. You know, I can't. I can't recall a time when I haven't ejaculated prematurely. I mean, it seems like every time I have sex, it's an ongoing thing.
And like most men who suffer from premature ejaculation, Darren has tried a number of methods to solve the problem.
I try thinking about different things. Music helps a little bit. If I have good music that I like, it kind of takes my mind away from what I'm doing. But for the most part, when I'm doing it, I can't think of too much else. I mean, not too much has helped. My goal is to please them before there actually is any penetration. So that way I don't have to worry about my performance when actually do penetrate. Every time